How is the dose of electricity determined during ECT for schizophrenia? Have you ever wondered how doctors determine the amount of electricity used in electroconvulsive therapy for schizophrenia? It's a fascinating process that involves careful calculations and individual assessments. The dose of electricity is primarily based on something called the seizure threshold. This is the minimum amount of electrical charge needed to trigger a therapeutic seizure in the brain. To ensure the treatment is effective, the electrical dose is set above this threshold, which is known as a suprathreshold dose. Several factors come into play when calculating this electrical dose. First, the total electrical charge delivered during the therapy is calculated. This is done by multiplying the current intensity by the pulse width, pulse frequency, and train duration. Each of these components plays a role in how the therapy works. When it comes to the placement of electrodes, there are two main types of electroconvulsive therapy: bilateral and right unilateral. For bilateral electroconvulsive therapy, where electrodes are placed on both sides of the head, the dose is typically set at about 1.5 times the seizure threshold when using brief pulse widths, which are around 1 millisecond. If ultra-brief pulses, which are about 0.3 milliseconds, are used, a much higher dose may be necessary, sometimes up to 6 times the seizure threshold. On the other hand, for right unilateral electroconvulsive therapy, where electrodes are placed on just one side of the head, the dose is usually 4 to 6 times the seizure threshold when brief pulse widths are applied. The pulse width and electrode placement significantly affect the dose needed for a therapeutic effect. Shorter pulse widths often requiring higher electrical charges to achieve the same results. Most electroconvulsive therapy devices have limits on how long they can deliver electrical stimulation, known as train duration. They also adjust the pulse frequency to increase the total charge delivered during the session. In practice, the dose is tailored to each patient. This process begins by determining the seizure threshold during the initial electroconvulsive therapy session. After that, the electrical charge is adjusted to a suprathreshold level to maximize effectiveness while minimizing side effects. This careful balance is especially important for patients with treatment-resistant schizophrenia, where electroconvulsive therapy is often used alongside medication. Typically, electroconvulsive therapy is administered as a series of sessions over several weeks. The principles of dosing remains consistent, but treatment protocols may vary based on how well the patient responds and tolerates the therapy. By taking all these factors into account, healthcare providers can ensure that the treatment is both effective and safe for each individual patient.